Well, Joe, do you want to get started?
Yeah,
I'll let
let's.
people in if they come in throughout.
Great.
Okay, so, well, good morning, everyone. Thank you so much for joining us today. In case you're not sure who I am, my name is Elise Fry, and I'm the Group Health Manager of our Health Plan Options Department here at URL Insurance Group. So now for a few housekeeping items before we begin. There's a blue bar that you can click and access the Q&A or chat and download handout materials. So I'm very excited for Joseph Candio and David Blanchard to join us today so they can give us an overview of what benefit solutions Vitori can help you and your group clients with. I would like to mention one edit to the title of this webinar. Vitori is now only focusing on 100 plus groups, so they only go down to 75 enrolled versus the 50 in the title. So without further ado, go ahead and take it away, Joe.
Thanks, Elise.
You're welcome.
As Elise mentioned, my name is Joe Candio. I am the Vice President of Channel Sales for the Mid-Atlantic region and Northeast of Vitori Health. I appreciate everyone's time this morning. Elise, if you want to go ahead and throw up the first poll, and then we can get kind of rolling on everything.
I can do that. All right.
Excellent. The first poll, kind of thinking of everything. And I know there's a lot going on in the health insurance world, the benefits world. So would love to get some feedback as far as what kind of biggest issue, biggest hurdle you have with your clients or what they've expressed to you.
Okay. Where did open? All right. I only see one person answered it so far. But it was okay. Now we have two, but it was all of the above. So for the one.
Great. Well, so let's just assume it's all of the above as far as the biggest obstacles, issues you have with your client's health plan. And what Vitori Health is built to do is to alleviate all those areas, right? How great would it be if you could go in and meet with a client at renewal or a new prospect and sort of say, well, hey, look, your network access, you don't have to worry about your inflated premium costs. We're going to save you money on that. We can adjust your employee contributions, and we can help the benefit design structure of your health plan to better attract and retain your employees. So what Vitori Health does is we use something called fair market payment. And it's easy for us to get lumped into the reference-based pricing category, which we are not. Reference-based pricing, as we all know, is sort of a set percentage over Medicare across the board. Vitori Health uses what we call the fair market payment system, and we have basically this algorithm that takes into account, claim service type, geography, various reimbursements. So what PPO reimbursement, cash reimbursement, HMO, facility costs, all that stuff, and it spits out what we call a fair market payment. So one area could be 140 over Medicare, and then the next it could be 280 over Medicare or 320. It's going to vary based on all those factors. One of the things that makes this so attractive to the providers, the facilities, is that we pay our claims within 5 to 10 business days. So our motto is to pay them fast, accurate, and fair. And with our fair market payment system, we do that. Now, based on the response we get from providers, they love it because, as we all know, the BUCAs are basically reimbursing anywhere from 60, 90, 120 days out. And other reference-based pricing models, you're getting reimbursed at that set cost, and that's it. If the provider doesn't like that, then from there, the provider will wind up kind of reaching back out to the member, the client. There's a balance bill. Then the broker has to get involved. Then the reference-based pricing models attorneys get involved, and it turns into a whole big rigmarole, which, again, we don't focus on. our whole structure is built on the member experience. So what we look to do is we want that member to be able to focus on their health care, their whatever diagnoses and health issues they may have, and not have to worry so much about the health insurance aspect of everything. Is this going to be covered? Am I going to be in network? Am I going to be out of network? We handle all that. We have an actual concierge team. So each client will have their own concierge person and one number to call. So Joe's Plumbing is going to have one number, and they're always going to get the same concierge person to speak to, unless that person's on vacation, sick, or possibly on another call. And we did that on purpose. We want that to be simple and straightforward for the member and the client. And honestly, it helps a lot for the broker. Because basically when there are issues with a health plan, employee complains to the HR, the CEO, whomever, and then guess what? That falls back on the broker. So we want to alleviate a lot of that. Go to the next slide. So because of our model, now we have an open access model, and it utilizes the fair market payment system, as I stated. We also have the ability to pair it with a physician-only network. So we use Prime today. And the other thing we can do as well is we can do a dual option with Cigna if need be. Based on using our model, we've been saving anywhere from 20 to 35% off the medical spend. So as you can see on the financial impact analysis sheet, we've been able to successfully save money for these groups. And one of the things I will let you know, if you go to vitorihealth.com, we have a savings calculator on our website. Just takes a couple of pieces of information on a potential client, a prospect, a renewal, whatever. You plug that information in, and what you're able to then do is you get a financial sheet, a PDF, and it'll go over that group's EBITDA, cash value, all that stuff. I wanted to introduce David Blanchard as well. He was able to join us. He's our Chief Revenue Officer at Vitori Health. He was able to just hop on. So,
yeah, sorry I'm late. I was there. I just couldn't get my camera to work. So I'm now fully here.
You.
David, I don't know if you want to add anything in regards to the financial impact analysis sheet.
No, I mean, that's the core of it. Is it's a great tool to use to see what kind of impact the Vitori model can have for a client or a prospect. And as Joe mentioned, the packet it's the output packet is a really nice PDF that you can take. You can brand to a prospect or to your client and go out the door with it. It's a nice handy conversation piece to really get the employer engaged.
And I will say for all of you on the call that I actually have spoken with several brokers who use that tool to prospect, and they're able to kind of plug that information on a group they want to get into. They email it, and they're getting meetings scheduled because of that. Because that employer's going, okay, wait a second, I want to hear more about this. So as we mentioned, the fair market payment system is our proprietary system. Basically, we're saving clients upwards of 30% off their medical spend compared to the BUCAs. And we're totally different from RBP. It's easy to lump us into that RBP category, but we're definitely not RBP. We are fair market payment. We have the ability to pair it with a network, a physician-only network. We also can do a dual option with Cigna. And if anybody on the call has larger groups, we can even offer a slice. So these are some of our most impressive stats. The biggest one I'm going to go over, which I tend to focus on, there's actually two. One is it's actually not on here, but we have 100% client retention. We've been paying claims the last 6.5 years, 100% client retention. Clients get with us. They love our product. They love the concierge and the member experience. That's the big thing. And they don't, obviously they don't leave. It allows them to focus on their business, focus on their employees, any issues they have. Like I said, the concierge handles it from start to finish. The other big one is our balance billing aspect. 0.24% of our claims result in a balance bill, and we resolve those as quickly as possible. Usually it takes anywhere from 1 to 2 calls with that provider or facility to get that resolved. I will tell you that BUCAs are anywhere from 2 to 5%. In some instances, I've been seeing it a little bit above 5%. And for reference-based pricing, it's upwards of 10%. And in other instances, it's close to 15 I've seen. So those are some of the big areas that we focus on. David, I don't know if you want to add anything to that. You're muted, bud.
I know. I can't get to this button quickly enough. No, I think that's the key element there is 0.24% balance billing rate. It's a measure that a lot of brokers and employers use to determine sort of the employee friction. And the point of us showcasing this is that in that regard, the sort of disruption or friction that an employee might experience with Vitori is actually about 1/10 of that of even the BUCAs. So if BUCA is at 2 to 4% and we're at 0.24%, that's 10 times fewer instances of balance billing at the bare minimum. So that's a huge improvement, and that's one of the reasons we have net promoter scores in the 80s, and certainly reinforces the retention at 100% that Joe mentioned. So it's an important part of our model is to save the significant money that we can save with our algorithm and how we pay with fair market payment, but without putting all of the burden and just shifting it over to the employees' backs and having them have a horrible experience. So it's been a really powerful way to have better benefits and a lower cost, which seems to be the holy grail. And it's been what most employers are always asking for is better benefits at a lower cost.
Right. Thanks, David. The other thing you'll notice too, so since our plans are self-insured, we basically we're doing a typical 70 to 85% off bill charges. Again, another huge savings for health plans. So you put all that together, and as David mentioned, it's just, it's a win-win all around for both, for the employer, the employees, and the broker. So this is our fair market payment process. As I mentioned, we take a look at various service areas, past reimbursements, provider payments, things like that. And then we start to finish, we go through all of it with the plan document, the claims administration. We will have our concierge reach out to the providers if need be. We can do educational pieces for the providers as well as the employer and the employees. You're going to use the plan the same way you would a legacy carrier, right? You have your card, you present it. Every now and again, the physician's office is going to reach out and say, listen, we don't know what this is. And really all they're looking for is an EIN number and just how they're supposed to bill, where they go, what they do, what they submit, all that stuff. And we take care of everything. If there is a balance bill that would come across to a member, we instruct that member, you got to reach out to the concierge that's attached to your plan, and the concierge will handle it then from there. The member is not responsible for paying that balance bill. And we have set it up that way. We don't have lawyers that reach out and, threaten to sue the provider, which then turns the provider into suing the patient directly. There's none of that. And we did that on purpose. This whole product and Vitori Health was designed by folks in the benefit space, brokers like yourselves who basically kind of took a look at everything and said, look, there's got to be a better way. There has to be something that's, more compassionate and provides better health care and coverage for employer groups. And that's what we were able to create here. As I mentioned earlier, we have 4 models available. We have the single model, which is the full fair market payment. So there's no network restrictions. You can go wherever you want. As I said, it's not RBP, and I'm going to keep reiterating that because it's easy to lump us into the reference-based price category. So, we are totally different from that. Our payments and reimbursements fluctuate all over the place. The other option is we can do our fair market payment system with a physician-only network. And basically the way that would work is, think of it more of a security blanket for those. So if the member's not in network, the provider's not in network, then it would still hit the fair market payments. So there'd never be a quote unquote out of network coverage. And then we can pair it with Cigna. So we would have, the Cigna plan, and then mirroring that, we'd have the fair market payment plan. And then that way you can kind of drive the enrollment based on contribution levels. Elise, do you want to add the second poll? Put that up real quick.
I can. All right. So do you have any clients with an RBP model is the question. Give everybody a few to answer. Okay. Anybody else? Well, it's 50-50.
Okay. So I will tell you that David and I and the rest of our strategy and sales team and leadership team at Vitori, we all agree that 9 times out of 10, the easiest clients to get on board with Vitori at the start are those who are currently with an RBP model, because they kind of already, for the most part, understand that concept. They've taken that leap, if you will, to going into that. So, it's an easier conversation to have. And for those that are maybe fully insured or even self-insured with a legacy carrier, usually pairing our fair market payment system with a physician-only network or even a Cigna, that's kind of the easiest transition. One of the other things that we offer to help with that transition and to help employers kind of say, okay, wow, this is great as well, outside of sort of the savings, is we have a nationwide preferred surgical excellence program. And so basically, this is for all members of the health plan, and we look at high quality surgeons and facilities. Again, it's handled by the member concierge. So the concierge service will reach out, do the scheduling, work with the member, work with the provider, and we make sure it's high quality and low cost pricing. And basically the way it works is if a member needs, now there are certain procedures that you're required to go through the Surgical Center of Excellence: bariatric surgery, total joint replacement, and spine. Anything else, any other electives, that member can choose to use the Surgical Center of Excellence, but if not, they can go to their provider that they like to see, their orthopedic, their general surgeon or whomever. What the Surgical Center of Excellence will do for the member, though, is there's no out-of-pocket expense to the member. If there is a travel, which most of the time the travel is about 60 to 65-mile radius, but if there's travel involved and lodging, Vitori will cover travel and lodging for 2 people. So the member, and if they want to bring a partner, a friend, whatever, we will cover that. David, I don't know if you want to add anything in regards to the Surgical Center of Excellence program.
I'd say it's the most popular platform and tool that we offer as far as what HR gets the most credit for. So adding this coverage to all of our plans allows people to have free surgery for all these elective surgeries. And so right away, if you've got an employee that has a need and they can get it for free at a facility that is top of the line, top notch, well regarded, with the lowest readmission rates in the industry, and they can come back to the employer and say, hey, I just got my hip replaced for free thanks to Vitori Health and employer. It's a really big recruitment retention tool, and it's just one of the enhancements that we've been able to add to the health plan because of the savings that we're able to generate overall. So it's a really, really popular program, and it's really effective for the whole plan.
And with this program, we have about 450 to 500 providers that are part of this program, and about covering about 1,500 to 2,000 procedures. So the big one is our pharmacy platform. Obviously, pharmacy is a huge topic. I'd say today, but it seems like every year for the last 20 years, pharmacy's been a big deal. And so our pharmacy program is a little different. We are not a PBM. We are actually a group purchasing organization combined with sort of a pharmacy association, if you will. So we're part of this national network with about 67 to 70,000 pharmacies. So you've got the major pharmacies, you've got independent pharmacies that are part of it. And basically what we wind up doing is we work with those pharmacies. They provide us every 24 hours a list of, I guess, the lowest cost drugs that they dispersed. And those drugs then, that's what hits the plan for all Vitori clients the next day. So if you have a drug that was $100 today, tomorrow that drug is going to be dispersed at $100. That'll hit the plan. We also have international drug sourcing. So the way that works is for specialty meds or drugs, if we can't get the best price domestically, we hit Canada, UK, and Australia, and those go into the international drug sourcing program. Built into this pharmacy program is our manufacturer's assistance, financial assistance, rebates, coupons. It's all built into the program, 100% pass through. We don't make any money on that. We make our money on a per script fee, and that's it. So any type of savings, it goes right back to the client, and that's done monthly. Okay, so this is a pretty cool slide just because it shows sort of the savings that Vitori Health can provide to its clients. A lot of our stuff is baked into the plan. So for instance, telemedicine is included. I know we have certain hearing aid is included. Bariatric surgeries are included. So we have all sorts of different things baked into this plan that should be included. And, one of the things that our clients love is all the options that are available to them, really at no extra cost. That's included. And so you can see on this slide just the various savings that are available. So, if you have, we'll take a look at the first one, a PPO plan, knee replacement is going to be 40 grand. With Vitori, it's 20. So that health plan's already saving $20,000, right? And this is how we're getting at trying to bend that cost curve. You hear about it all the time, and, this is our program, our solution does that. And it puts that money back into the employer and subsequently back into the employee, whether it's via contributions, better benefits, or all of the above. Again, our goal here is to make it easy. That's our focus. It's all about the member. And for the brokers, sometimes this is a difficult solution to present. And we don't want you to go in it alone. We're here to help. So, our question would be, which you could probably put up, Elise, is that poll question. How many clients do you have over 100 plus, 75 plus? And we can, that's the first start. Any clients that you have that are 75 enrolled employees or more, identify those with us, reach out to us, and go on our website, tinker with that savings calculator and see if they're a good fit, and see what type of savings you can provide them. And, we have, when it comes to quoting our product, it's pretty basic. It's similar to how you would quote the legacy carriers. We would, need a census, 2 years of claims data if they have it, and, current plan design, renewals if they have that as well. And we send it out. We have the ability to shop the stop loss, but we don't have to. We work with about a handful of probably about a dozen stop loss carriers. They obviously know our product and know what type of savings we're able to generate, but we don't make any money off the stop loss. So if a broker has a stop loss carrier they prefer, that's fine. We can work with that stop loss carrier. We have no issues doing that. We make our money on the admin fee, on a PEPM admin fee. So, that's basically the easiest solution. And once you send us that information, I think we'll send out some handouts as well as the opportunity intake form. But, you can present to your client, but we encourage you to bring us along just because we're the experts on it, right? You're going to get hit with some of those hard questions that we don't want you to go, well, wait, let me check. I'm not sure. Let us do that heavy lift for you. David, I don't know if you want to add anything to that. All right.
All good. I think that's the biggest element is we're just trying to make it easy and get the teams aligned, and that's part of the value that we've brought to the table here with this model.
And I will say that we understand not every group is gonna be a perfect fit for this. I don't think it would be fair for us to say, hey, we want your entire book of 100 plus. But include us when you're going at renewal at a new opportunity that you're going to quote a solution. Include us in that. Doesn't mean you have to place it with us right away, but include us in that to help start that conversation and bring us in to talk about it with you. We can strategize and kind of discuss what makes sense, what doesn't. And I think that's probably our big ask today is just when those opportunities come up and you're looking at a Cigna, an Aetna, a Blues, put Vitori in that model.
Yeah, I think that, and as we talked about earlier, if you've got a reference-based pricing client already and it's easier to transition to us from that mindset, you'll actually find that we are more affordable, believe it or not, than the RBP because our sliding scale of payment and because of our pharmacy program. And as Joe said, we're not making any money on anything except our admin fee. So we're not scraping back some of the shared savings from the medical claims. All of those claim savings are the employers. All of the pharmacy rebates and pharmacy savings are the employers. So we actually can save money and have fewer headaches and challenges than an RBP platform might have. I actually heard a horror story yesterday from a past colleague who took over BOR as a broker of a school system that was using a fairly established RBP platform, and they drug their feet on the negotiations of a claim from the University of Virginia hospital system. They this is the TPA and the reference-based pricing vendor, drug their feet so long that the contract terminated, the stop loss terminated and canceled for both specific and aggregate. And now the patient, the employee, has a $250,000 lien on their house. So that's the kind of thing that is out there in the market that is insane to me, that would never, ever happen with the Vitori model, but is inherent to almost all of the traditional reference-based pricing platforms. So with us saying over and over that we are not RBP, we are not reference-based pricing, it's because of stuff like that. So that's exactly why we are who we are, and why we think it's a significant opportunity for people to consider migrating to us from a traditional platform and save money without putting their employees at risk, and also away from the reference-based pricing platforms to improve the experience and save even more money.
Right. And that's our goal. I mean, it's if you can have, I think that first poll where we asked, what are the biggest hurdles of your clients' health plans? And it was, employee contributions, premium, plan design, access. I think everybody put all of the above. Well, wouldn't it be great if there was one plan that really solves all of that? And as David and I have mentioned, and the overall response with how we handle things is not to put it back on the member, put it back on the client, which subsequently then falls back on the broker, right? We've taken that out. And one way we take that out is our communication. We're there from start to finish. We help with open enrollment. We're constantly sending out information to members, to the broker, to the clients. We have on our website, we have cartoons explaining how things work. So they're like little video cartoons. And really, I think the overall constant theme as well has been our member concierge. They are always communicating with the members, and they're there for you to basically handhold any questions, concerns that you have. They're there to help. It's not like calling a BUCA carrier where you call one person and let me check, I don't know, you have to call this number, and you call them, and then no, you should have been back. I mean, I had to do that, and it's just a nightmare. So I think we can all kind of relate to that with our clients and possibly our own experiences. The other big thing too is we do meet with the groups on a monthly basis. We have reporting going over how their plan is running, claims info, all that stuff, so that it's not just you're out in the dark. And we're kind of just going, oh, well, here's your information, and you have to figure it out. That's not how Vitori operates. As I mentioned, we have, we focus on the member experience. The big thing is on the back of the card, you're going to have one number to call. Those members will have one number tied to their account. And that when that call comes through, that member concierge is going to know, oh, okay, this is Joe's Plumbing. Someone from Joe's Plumbing is calling, and they have all your account information, and they're ready to go. So, that's a level of customer service and support that's, when you think about it, it really is concierge style, right? You are sort of that, almost that members at that executive level type membership, if you will, that they can call in and get that sort of one-to-one hand-holding experience, which is really, really nice. Right. We went over dedicated member support line, one number coverage, 24/7 support. And then we also provide the comprehensive reporting based on, what those concierge questions that come up. So for a group, it's great to know, like, well, your members are calling about, access, or they're calling about this balance bill issue or a claims issue. So I think that there's definitely a nice, that's a nice piece to really see, and those groups can kind of go, okay, here's what's going on, and then we can kind of come out and say, well, let's do a little more education on this. So there's a lot there that we try and do, and we are more of a proactive health plan than only reactive. We have several success stories. I'm not going to go through all of them, but we can certainly email out to everybody on the call today those success stories. But we've been doing a lot of savings for these companies, and you'll notice the big one I'm going to talk about real quick, though. I know I said I wouldn't get into it, but if you notice the middle one, Pittsburgh, and they have multi-state employees, as all three of them do on these success stories. But Pittsburgh, right? Those members are accessing, that are in the Pittsburgh area, they're accessing UPMC and using Vitori Health to do it. And so that goes to show you that Vitori Health is accepting it. We're paying claims for UPMC. So, so I know those questions do come up. Well, what about that system? How's that going to work? What if? It's working because these clients have been with us for years, and we've been paying claims in those areas for years. So just to give you that heads up. And like I said, we our focus is really eliminating that waste and that excessive cost. And it's putting money back into the employers. And, some of them are putting it back into their health plan and taking a deductible of, $3,000 and lowering it down to $500. We've seen some accounts do that. We actually, David and I presented a few weeks ago where they had a large deductible and we lowered it. I think it was like a 200-400 split. Which was a huge savings, and we dropped the copays down, and we even took their spec and cut it in half. They had a $300,000 spec, and we cut it down to $150,000. So that's real money that's being saved for that health plan and that employer, and those are things that we're able to provide. And I can tell you. Oh, go ahead, David.
Sorry, I was just thinking to sort of even reinforce that even more. I think like 150 life group, 170 life group, 100 life group. If you've ever delivered a 30% rate increase, you know how completely flustered and terrified that employer group is. What if you could deliver a 30% decrease to their health budget in 1 year and help them reinvest that in all of these different areas that Joe described? I think that's a way to think about the differential. Instead of getting a 10 or 15 or 20% increase every year, you're delivering a 30+% decrease that doesn't inflate at the normal trend. I mean, our trend is at like 2%, not 10%. So it's a whole different ball game that you can recalibrate your clients with. So really powerful.
Yeah, it's funny because when we get brokers who quote with us, and then we send them the proposal, and they're like, wait a second, are you saying this is a 27% savings? Is that right? And yeah, it is. And then we can kind of say, well, look, let's adjust things. And so now you're really, like David said, you're reinvesting it back into the health plan. You're reinvesting back into the employees, right? Because that's the goal. It's attract and retain your employees and make sure that people are showing up and they're productive and they're efficient. The other thing we do, we're so confident in what we can provide that we have $1 million savings guarantee. So basically, for groups of 250 or more enrolled, we put our money where our mouth is. And we need, I think, 2 years of past claims data. And if we can hit our savings mark, great. If not, we pay up to 50%, or we pay 50% up to $1 million back to the plan, back to the back to the client, rather. Excuse me. So, it's more than just, we'll give you a credit or we'll give you this. Vitori is so confident in what we can do and provide for those clients. We are putting our money where our mouth is. And I don't know of anybody else in the industry that's doing that. They'll say, we'll give you a credit. We'll give you some type of, discount. We'll waive this. Nope. We are going to give clients that money back in their pocket.
And sort of on the same lines, like we have a level funded product that's from 75 to 150. 100% of the surplus would go back to our clients, not 50%, not 40%. That's the client's money, 100%. We've already talked about all 100% of pharmacy rebates go back to our clients. 100% of the negotiated savings on medical costs go back to our clients. So it's all part and parcel to the mentality that we have that this is the client's money. You're self-funded. There shouldn't be profit being made on the savings that the plan is generating. That's the client's money. So we pay, we're charged a PEPM admin fee. Everything else, truly the clients. And the $1 million savings we've never had to act on, but we're really proud to have it out there to illustrate that it's there and it's a real program, that's for sure.
Right. Yeah. And I will say that our quoting process, as I mentioned earlier, is fairly simple. Elise can attest to it.
It's easy. I did it the first time around. I got it right. It's literally filling out a fillable form and just attaching the rest of the information. It's so easy. Other systems and other quoting is more difficult because I've done it. Not gonna lie, it was so simple.
And we'll be sure that everybody on the call gets that information along with this presentation and some additional marketing materials. I'll open it up if there are any questions anybody has to ask or concerns. Certainly, the floor is open.
I know I don't see any questions in here, but I'll give everybody a few seconds or so to type any in if they have any. But yeah, I mean, I thank you both for doing this while we wait for any questions they pop in. Again, really, the takeaway is they make it very easy. They stand by, they back what they say, and they're good people trying to put out a good product for your clients and our clients. And if you have the right group, it's a really good fit and you really almost can't go wrong with it. So give it a shot. Still I think you guys just did so well that there's no questions.
That's great.
But I'll send out all the information. Everybody will get a recording of this as well sent to them via email. And I'll send the handouts along with the intake form for the quoting. And I'm sure I'll have a bunch of questions for you probably later in the day, Joe.
Okay. Yeah, that's no problem. And we'll be sure to send out my contact info as well as David's. If anybody has any questions, wants a separate meeting, we're happy to do that. If anybody, client they want to discuss or just kind of brainstorm some ideas and thoughts, again, that's what we're here for. And we're happy to do that.
Excellent. Well, I hope everybody has a good rest of their day, and I'll shoot out that information. I'll also include your contact information, so don't worry. And we'll just go from there.
Great. Thanks so much,
Thank you
Elise.
so
Thanks
much.
everybody who attended. I appreciate it.
Thank you, Joe. Thank you, Dave.
Thank you. Bye-bye.